Hi everyone, welcome to researchmd.com. Again, we're going to talk today about another clinical question, the role of low-intensity extracorporeal shockwave therapy in erectile dysfunction. Does it help in erectile dysfunction? That's our question, my friend. So again, my name is Pramil Cheriyath. I'm a program director, internal medicine residency, transitional residency. I teach medical students and residents. I'm also a director of research. I'm an assistant professor of medicine. So let's get into our topic. Erectile dysfunction is becoming one of the, it's very common. Age greater than 20 years, almost like 20% of the people in the male population have erectile dysfunction. Can you believe that? So it's a huge problem, okay? So the mechanism, if you look at it, you can kind of clearly, we just put this picture together. There's arousal, there's parasympathetic nerve stimulation, nitric oxide release, and then you got GTP converted into CGMP that causes smooth muscle relaxation, dilatation, and then you have erection. Below that, that's where the Viagra works. See, Viagra kind of stopped the CGMP breakdown to 5-GMP, so there's more CGMP available than smooth muscle relaxation, then you can have an erection, okay? Viagra is the #1 selling drug in the world. So what are the risk factors for erectile dysfunction? You had age, any diseases, if we know, older we get, the more likely we're going to have chance of having that disease, right? Many medical conditions, like you name it, from diabetes, hypertension, coronary artery disease, obesity, cancer treatments, or prostate surgery, injuries, medication, especially the beta blocker we use for blood pressure management, and then you got drug use, alcohol use in the society, and above, I mean, when you take all those kind of things, then you have to think about the psychological causes like stress, anxiety, and depression, okay? So what is extracorporeal shockwave therapy? It was several years ago. It was actually developed in Germany and Bulgaria by some orthopedic physicians. Kind of came from the lithotripsy, what they were using to crush the stones in the renal stones. So how does this mechanism? It kind of, studies have shown that you got like neovascularization, is increased blood vessel production, or angiogenesis we call, okay? There's mesenchymal stem cells recruiting more, so like the bone growth and all that. They stimulate cell proliferation and differentiation. So the repair and all that can be done faster. So there are mainly three mechanisms. There's anti-inflammatory, antimicrobial, and suppression or nociception are considered. FDA, this is an FDA-approved treatment for chronic outpatient therapy for chronic plantar fasciitis. So when you talk about extracorporeal shockwave therapy, you have two types. One is the low energy and the high energy. Remember that. They are kind of measured in the energy flux density. If it is low energy, is less than 0.12, and then high energy is greater than 0.12. So it's very important to use the low energy in this. That's what the study looked at. So we did some literature studies. We found those great studies, so we're going to talk about it today. So the objective of the study to investigate the benefit of low-intensity extracorporeal shockwave therapy in treating erectile dysfunction, okay? This is a systematic review and the meta-analysis. We know that when you have meta-analysis, you're pulling a lot of studies together. The strength is really high on the scientific hierarchy, okay? Now, so they used, I mean, in the low-intensity extracorporeal shockwave therapy, and then compared to like a sham or like a placebo therapy, okay? Then now if you can see this meta-analysis, you look at the diamond at the bottom, it's far away from the line, right? So it's clearly show it is superior, right, compared to placebo. Based on our study, this conclusion is that, based on this meta-analysis, low-intensity extracorporeal shockwave therapy is effective in treating erectile dysfunction, okay? Thank you so much for watching. We'll be back with another presentation soon. Thank you.